slides, but Cynthia and Karina, you're up. So we're going to start with the healthy voting team updates, or everything you've been doing lately.
Right.
Your updates.
More than updates.
All right. With that transition, that action is the antidote to despair. We were concerned about everything that we've just been talking about at the beginning of the summer, and decided that the best way to use our voice at this time was really to focus on climate, health, and voting for 3 months. So starting in July, we decided to form this team. So this is one of the advocacy teams that we've talked about, and we called it the Healthy Voting Team. So original, right? With plans for summer to fall 2020. And I am nominally the head, but Karina has really stepped up, and I have to give her equal billing on this. Can we have the next slide? So why are we doing this? Because it's absolutely imperative that we vote for leaders who will solve the climate crisis. And this is something I wrote actually for my Citizens Climate Lobby team back in, I don't know, June or July, that we are embarking on the election, not just of a lifetime, but the election of our existence. And this actually was a quote from Tom Steyer. Remember, he was on the call and said exactly that. And I think it's so true. And that we cannot afford to fail to elect leaders who understand that the climate crisis is a public health emergency. Michael Mann says we cannot afford another 4 years. The climate cannot afford 4 years of a Trump administration with all the rollbacks. And that's why I believe it's nonpartisan to vote for Joe Biden at this point. Although we're not allowed to say that as a 501c3 or for our partners. Next, please.
Yeah, I was going to say, we are allowed to say
Yes,
that.
we are
we
allowed
have not
to say
actually
that, and we
gotten 501c3 status yet.
So I want to give credit here to all the people that stepped up and joined the team. We've had a lot of people working on this, so thank you very much. And next slide. And we started meeting really weekly, although most teams will meet on a monthly basis. Given the proximity of the election and the amount of work we had to do, we have been meeting pretty much every week. And the first meeting, we worked on strategies. What do we really want to accomplish? The first goal was healthy voting. At that time, we were smack in the middle of the second wave of the pandemic, or just approaching the second wave of the pandemic. And we did a collaboration with the Union of Concerned Scientists, who had a huge project called Protecting Public Health in the 2020 elections. And our first webinar was with UCS Professor Michael Latner in July, and really focused on safe voting during the COVID pandemic, which was vote from home, absentee or mail-in voting, which is the safest from COVID, but also to try to make it familiar and trusted so that people would use it. And then advocating early voting to spread out the vote so that's not crowds at the poll. That didn't quite work, as we've seen from the lines in Georgia and Pennsylvania, et cetera. And safe in-person voting, how to accomplish that. Our first project was a letter to California County election officials, where we actually went into really serious detail about what needs to be done to protect both the voters and the poll workers. And that was actually sent to all 54 election officials, and it's been shared by Public Health Awakened across the country with many of their affiliates. So that was quite an endeavor, and I'm pleased to see that it has been put to some use. And in fact, some county election officials did reach out to us. I think Karina spoke with her officials in LA, and we spoke with some people in Contra Costa. And then the next big project was to say, now that we have this, how do we get this out to the states that need it? Because this was, I think, something we all feel in California, that we're in reasonably good shape here, and the states that are really going to impact this need a lot more help. How do we do that outreach? So we actually embarked on a huge project across the country to get people to actually take this information and write opinion pieces in their local paper. And leveraging our connections with the Medical Society Consortium state affiliates, with Citizens Climate Lobby, with the Doctors for Biden, with personal connections, we were able to connect with 30 authors across the country, some of whom worked together 2 or 3 at a time on particular submissions. We had, I think, 10 versions, which were submitted to 25, a total of 25 outlets in 9 states. And I remember Professor Latner said when we started this project, if you can submit 5 in these key states and get 1 published, we'll consider this a success. We have 7 published in the key states, 2 in Wisconsin, 1 in Michigan, Georgia, North Carolina, Texas, and Pennsylvania. Encouraging people to do what we said at the top. Vote from home, get an absentee ballot, even if you don't think you'll need it, because at that time the pandemic was kind of coming down. And try to vote early and make sure you wear a mask and sanitizer and stay distanced, etc. And the title of the op-ed, we wrote one template, which was called the Doctor's Prescription for Healthy Voting. And several of us worked on this. Started out, you might be surprised to see a doctor writing a prescription for healthy voting. But imagine this, it's getting dark as you rush to the polls. It starts to drizzle. You hear 2 poll workers called in sick. And it's just been so prescient. It's scary. But we felt really, really good about that project. And those connections that we made came in very handy for one of the next projects. So next slide, please. Ashley, is that you? Thanks. So the next thing we tried to focus on was turnout, and that's both registration and phone banking. So we partnered with Manisha Sharma of Vote Health 2020 and Bev Harp, and they both presented to us in August. And some of us started using the Vote ER and the Vote Health 2020 registration codes. And we encourage people to do phone banking, which is still open and still super important. If anyone has bandwidth to do that, especially we need Spanish speakers. So I would really encourage people to get involved. Flip the West, there's so many good sites. And if you want something nonpartisan, there's the Environmental Voting Project. Next, please. And what we were trying to do there is help make people, with the registration, help make people comfortable with the idea of using our health voice around voting, because so many physicians have confused being political with being partisan, which is why I keep harping on that we must be political. Policies are like that everybody should have health insurance, that we shouldn't smoke, that we should have gun safety, and I was so impressed by Manisha Sharma. The main thing that I got from her was saying that voting is a social determinant of health. And we really need to encourage our patients to register and to vote and use their voice, because that really determines what kind of services that they get. And so we tried to get people comfortable with saying, I can treat you for this problem today, but climate change is making it worse. I can't protect you. That's why we need to vote leaders who will act on climate. You'll probably detect a theme here. Make sure you're registered, request a ballot, vote early. Your vote is your voice. And we created, or Ashley and Amanda created this wonderful sign, which is now a yard sign.
Just Ashley, but it is very cool.
Next.
Sorry, the yard sign is available on our website in our storytelling shop. So
I'll put the link into the chat.
yeah,
Too.
totally.
Okay, next, please.
Okay.
And then the final phase of this was then now to say, how do we actually get people to vote for, they're going to vote safely, but how do we make sure they understand that they need to vote for climate and health, that we need to elect leaders? And that was the focus of our webinar in September. We had a toolkit for candidate questions, and Margie has been a champion of that and helped out with a candidate forum in San Francisco and got those questions out. We worked to do videos with Healthy Voices for the Planet in association with the Medical Society Consortium. And the pièce de résistance of this whole effort was the Dear Patient Letter campaign, which had actually originated, I think, before all this started. I'm not quite sure. That sort of emerged as a separate idea. And then we folded that into our Healthy Voting team as we're like the support flank. How do we help get that out and amplify the message? So Ashley's going to talk more about the actual campaign, how this originated, but we worked really hard on, once we get the signers, how do we amplify that message? By getting press coverage and contacting reporters, by promoted social media and getting LTEs and op-eds. And I would love, I don't know, Amanda, if you can do a quick poll to see how many people have actually submitted an LTE. You know how to do that?
I don't. I mean,
All right. Next time, Mel, maybe
is there
people
does anyone know if, is there a polling thing built into Zoom?
I
Yeah,
think we
there
have to
is.
set it up ahead of time.
I think we have to set it up
Oh,
ahead of
okay.
time.
Yeah.
Yeah.
Well,
Exactly.
be fun.
You have to set it up ahead of time.
Yeah.
okay.
I mean, we
Right.
could ask.
We
if
could
you
raise
like
hands.
raise your hand. Yeah.
Yeah. Yeah. So maybe we'll do that afterwards.
Oh, look at Heather submitted LTEs to the San Francisco Chronicle and Marin. Thank you. That's wonderful.
Yeah, I want to know if anyone submitted to Contra Costa to the East Bay Times yet. We need to get some there. I submitted one to USA Today. That's really a stretch, but I thought we've got to try. It's the only neutral newspaper in the whole US.
We
Okay,
can do the East Bay Times
Okay.
later today. Yeah.
great.
And Bill,
Next, please.
Thanks for sending the one to the SAC-B. That's great.
Yeah. And so for the press coverage, we worked with the consortium, was really helpful and let us use their press people who sent it out across the country, and it got picked up in Washington State, I think with a connection from Ashley, and they did this terrific article, which is, I think, both radio and print. And this was
Yes.
the title.
Mhm. Yeah, exactly. Yep, it was in the NPR, it was on the NPR broadcast, and then there was also a print. And
Mhm.
we're going to talk more about this in our toolkit too.
Right. And this photo was actually, if you can go back, you say, what is this photo? Well, this was Seattle, and you can barely see because of the smoke. That was,
So if anybody doesn't know, I am from Seattle. So this was especially exciting from my hometown, and the Space Needle being shrouded in wildfire smoke is
mhm.
says a lot.
Next, oh, sorry. And then the targeted Facebook ads. The consortium was doing the Healthy Voices for the Planet in these targeted states, Wisconsin, Michigan, Pennsylvania, and Florida. And so our message really is very similar to theirs. So we did this targeted Facebook ad in the other key states above the Dear Patients letter. And this was the actual ad that comes across, which was really cool. We thank the consortium people for the press people for this, because each state has their own, Arizona's doctors and nurses are seeing the health effects. They're deeply concerned and ask you to consider protecting the climate to protect your health. And then, have you read the letter? The cool thing is, even if you haven't clicked on this to read the letter, the whole message is there. And we have this very concerned physician who happens to be one of the heads of the Montana state affiliate in the consortium, and his patient. And although there was some question about, well, is this the best visual for these states that we're targeting? This is a really good visual. Next, please.
Can I add a little bit to that? I think, is it okay, Cynthia, if I share the background of how this
Sure.
happened? Okay, so I am so grateful to Cynthia, because these Facebook ads, it was new for all of us to like pay to boost on social media. But the brilliance of these is that they're targeted to the swing states, which, getting out of our echo chamber is something we've talked about a
That's
lot.
cool,
And
right.
this was only made possible because Cynthia really generously donated her own $6,000 to the consortium, which is 501c3, and then the consortium placed the ads as being an organization. So, you know, this was really like an amazing contribution that Cynthia brought in order to get it out of Northern California. So a huge, huge gift to get the message out where it's needed most. And then you're going to talk more about the clicks and like how many people have seen it, right?
Yeah, I hope maybe Karina can help me with that.
Okay.
But the other thing, go back to that for 1 second, please. The other thing that's really important is that the social media people and you know, there's a whole team that the consortium helped us with in Dear Patient Coalition, that it was not just targeted to these states, but they could also target it to people with certain mostly women, certain income groups, people that show certain interests. So it's really hopefully persuadable voters and or people who would resonate with this message to help get out the vote about this. So this is really, that was our goal. Again, we were constantly thinking, how do we get this out of California to the places that are really going to make a difference? And
in terms of
say,
click views, there were, as of yesterday, 24 hours ago, there were 75,000 views of the ad and 1,800 clicks on the letter, but I'm sure that's increased and it's going to run through November 2nd.
Yeah. And the consortium team was just so fabulous. We decided to do this like on a Wednesday or a Thursday, and they got it up and running on the Friday, 2 days later. So we all just scrambled to make sure that this could get up last Friday and have a good week, 10 days to run. And I have to say about the donation, I do donations for environmental things every year. So I just put it the place I thought it would do the best. So next, please. And then the last thing we were working on was saying, how can we amplify this message? We weren't able to get a big national press coverage, although we are getting the radio coverage. Somehow I skipped that. That was all. I skipped the interviews. Something was missed. So back to
That may be my fault if I pasted the slides incorrectly. I'll look to see if I can quickly find that slide.
I'm not sure, but we also tried to get these radio ads out. We said that we got the one to KUOW. Maybe I left that out, but we also worked to find people in 11 states or 13 states it ended up who would do these similar radio interviews. And again, it was all of those states and the connections that we had made with the healthy voting op-ed authors allowed us to quickly find people, well, mostly quickly, who would do these interviews. And then the connections like with Citizens Climate Lobby and the consortium also really helped us in some of these states. Like we were able to find someone to give an interview in Iowa, which was like amazing. So that, and the signers of the Dear Patient letter, we combed through that as well. And so again, getting out of our bubble, here is the first letter, moving on to the letters to the editor to amplify. We sent out sample LTEs and op-eds to everyone who had signed the Dear Patient letter, asking them to write to their own papers. And this is the first one that was published in Arizona, saying climate health is a human health problem, and for your health, vote for legislators who will take the climate crisis seriously. Yeah. And we're now having, Karina, do you want to report on what we know so far about how these LTEs and op-eds are doing?
I'm not sure that I know because they're still in process. I know that at least four LTEs have been published, but I know that many more have been submitted and are being submitted. Mm-hmm. I even just submitted 6 more last night. So I know that's a work in progress, but I think we've been super successful so far, and the word really is getting out. And I don't know if you were going to say this, Cynthia, but I think somebody asked, we're so used to now measuring everything, how are we going to measure whether this had any impact or not? Or, I mean, we can measure certain things, how many people signed our letter, how many radio interviews were broadcast, how many pieces were written and published. We can count all that, which is fun because we've had big success, but then you can just imagine the ripple effect. I mean, there is some, how big is it? How, we are just one group, and I think we've done a lot, and there's so many other groups, so all combined together, I think we definitely are having an effect.
Agree. So I think, and we're going to talk more about the specifics of what have been published as we turn to our action section of our meeting. But let's see, Cynthia and Karina. So did you have anything else you wanted to share before
I think just that the whole process, really depended on teamwork. I'm really proud of the way we came together, that so many people contributed, and that we came up with a strategy that evolved somewhat over time in terms of how we were actually going to do things, but that really used every tool that we have, that used every way that we could get out our voice, and that those connections that we forge will help us going forward. Yeah, and it's kept me from worrying about the election, because I'm just worried about, do I have the interview scheduled in Iowa and North Carolina?
Action is the antidote to fear.
Exactly. And I wanted to say, whatever that saying is, when we were talking in the beginning about what we're worried about the election and Amy Coney Barrett and all that, whatever that saying is, whatever you have control over, there are things you can control, things you can't. We couldn't control the Supreme Court fiasco, but I have always tried to do some actions for the election, and but this year, with the support of CHN and especially Cynthia, with all of your knowledge and experience, I've learned a lot, and I feel like, I mean, I'm sure I could have done more, but I feel like I have done at least my share, so that makes me feel good. And I think we all have really come together, like Cynthia said, to work together really well, which is super positive.
Yeah. Does anybody else from the Healthy Voting team want to comment?
I have one comment, but I can wait a second if somebody else has another.
I can comment. Sorry, I had to pop off for Zoom kindergarten attendance taking. But I just wanted to say that I've just been so inspired by the initiative and the leadership, Cynthia and Karina, Ashley and Amanda, and you guys have really it just gives me goosebumps to think about 4,400 people, taking the time to read the letter and sign it and share it with others. So I had a great time on this.
Great.
Oh, sorry, was somebody going to say something?
That meeting in a smaller group has also been really great to get to know this team better, and so that's been a really positive thing for me, is to get to know Cynthia and Karina and Meg and Renata and all the people who've been on this team and work together and feel like we're in this together. So that's been really positive.
For sure. Yeah, I think that is the beauty of the teams. Great.
It's wild. I find myself thinking this a lot, like very few of us have actually ever met in person, which is mind-blowing to me. Like, yeah. I think I've actually only ever met Cynthia in person like 3 times, and I've never met Karina in person. It's just like crazy.
Oh,
yeah.
So sad.
But
some of our best friends.
Amazing. Right? Yeah. The one thing I just wanted to address, and Kathy, thank you so much for putting this in the chat. I just wanted to address this question that has come up a lot and I think is incredibly, incredibly important, is this question of, as the letter was written and through sort of a variety of decision-making points that we won't go into now, it was decided that only, that we would limit the signers to current, future, and retired physicians and nurses. And we've heard a lot from many different people that they are, that they're, it's tempting to say they're mad that they couldn't sign, but I think to put a different spin on it, that they want to be able to sign a letter like this as an allied health professional. So one big thing that I'm starting to really think about, obviously it won't be timed with the election, but as we all know, this work, regardless of what happens next Tuesday, is far from over, is how can we make this something that has an even broader base across health professionals? And I know that that's something that some of our allied organizations are also really interested in, especially PSR National. So if people are like, Kathy, if you're interested in talking more about this, I think there's just a lot we need to do there and think about, even just in terms of like, would it be a different letter? Would it be the same letter that people could sign on to? But I appreciate your putting that in the chat, and that's something that we're really starting to think about.
And if I could just
I just wanted to say that I think that's really critical. When we thought a lot about, I was the director of CME for about 18 years, and we tried as much as possible to roll out the same message to everybody on the team so that everybody knew what everybody else was doing and they reinforced each other and felt like they were part of the process. And I think being as inclusive as possible is really important.
And if I could just mention that we are still trying to get the message out, and you don't need to be a signer of the letter to write letters to the editor about it and to do social media about it. So we would encourage everyone to reach out to other members of their team and ask them to use their voice where it is most effective, whatever outlets they have, that there is a way for them to be involved in this, even at this point, which would be very important.
Yeah, for sure. I think the inclusivity factor, though, is really important. And at the beginning, we were trying to leverage that when Americans are polled, the most trusted voices are nurses, second most is doctors, third is pharmacists, and that's what we were trying to leverage. But we all know our work is big and we need the biggest coalition possible, and the health voice more broadly writ, I think, is something that we will move in the direction of in the future. And I also just wanted to articulate, I'm new to all this, and I think this work and kind of the connections that we've made across the country that Cynthia was talking about, this has been a real organizing tool, and we now have new connections in places we never did. And I think, we've really broadened our network and our coalition really through this process. And so not only has it been an organizing tool, but also now we're mobilizing with the things that Cynthia's mentioned. And so I think this is an okay moment to transition to, so we have 6 days left to really squeeze every drop of use out of this organizing effort that we've put so much energy into. So what I'd like to shift to is, we have a toolkit, of course, which is, I'm gonna actually, let me see if I can go to it. So Amanda, if you could drop the toolkit link in the chat. And so we really want to kind of finish super strong in a way that amplifies all of the media coverage that we've been getting about the letter. So, we're not focusing anymore on really getting more signatures. It's all about, every LT published or every interview that gets published using our networks to then multiply out the visibility of each of those. So this toolkit is something that I'm wondering if we can try using it right now as we go through. So at the top is the coalition who helped to bring this letter to the 4,500 signers. And so in the next 6 days, we're hoping that you could, or even right now, copy and paste some of these posts to your Twitter or Facebook or LinkedIn or Instagram accounts so that your networks see the letter and see the press coverage that we're getting about the letter. So these links don't link to the actual letter, they link to press that we've gotten about the letter. So there's been one interview with Amanda. Actually, this first one is like just a few minute interview in California. So it was published in Sacramento. So maybe you want to copy and paste this first one and put that on your social media outlets. The second one, the KUOW, is a print version of what did air on the NPR station in Seattle. So this is another way to amplify that coverage that we got. And then this third one in the Advocate, this is in Louisiana. So if you know anybody from whatever part of your life who's in Louisiana or the South in general, maybe you could send them this and ask them to post it, or maybe you could like tag them on Twitter. But this would be kind of a locally relevant issue for anybody in the South, that was a really good LTE that we got. And then the fourth one, I should have numbered them, is in the Seattle Times, and this was an LTE. So again, maybe in the West or the Northwest, you could use this one to reach out to your connections there. And then the last one in the Northern Express. So this was published by Lisa Del Buono, and it's in Michigan outlet. So if you know anybody kind of in the North Central, the Midwest and North, this might be the best one to post there. So we're hoping that what you could do, should we try to do it right now, or should we just ask people to do it later?
I would do it right now.
Yeah, so maybe you could just copy and paste. And if anybody's having trouble opening Toolkit or anything, let us know. But these are just kind of, plug and play, ready to go. So you could put them in, for instance, I'm on like a physician women Facebook group. So I'm gonna post these into there. So maybe I'll do that. And if you wanna post it to a Facebook group or a Twitter, your own Twitter account, maybe we'll just do that right now.
Or I think if you don't use social media or have already shared on social media, another thing you could do right now would be to submit an LTE. That shouldn't, especially, if you use the template, it doesn't take very long. I'm actually going to try to do the East Bay Times right now.
Okay. And so maybe the LTE template.
And I just put up the submission links for the Chronicle and the East Bay Times.
Awesome.
Or in the chat.
And I think, again, for the LTEs, the more local in many ways, the better. So even, the East Bay Times is very hyper local. And for those of you all who are in other parts of this, the state or the country, go for your most local paper.
Right.
And I'll add one other thing to that is that the more letters they get on a topic,
Right.
they read every letter. So if you don't get published, don't feel like you're not contributing.
Right. The more people that submit, the better. So even if somebody else says, I'm doing Contra Costa, if we get 6 people to submit in Contra Costa, there's a better chance that they'll publish at least one. If they just get one, they'll say, oh, big deal.
Mm-hmm. So what I'm doing
The
right
final
now.
add-on to that is it's probably not so good if 6 people submit exactly the same
Oh,
letter.
yeah. They all have to be
So
adjusted a little bit. Yeah.
reword it, put it in your own words.
So I'm going to paste a template that you can just copy if you want, for the LTE submission. So you could, this last one that I put in, so you could just copy and paste that, update it just a little bit for your local paper. And like earlier, Amanda said she was going to do it for the East Bay Times. So that's one template. Cynthia or Karina, is there a second template for the LTE that you could put in the chat right now? That was the only one I had.
I put the link to the Google Doc that has both templates in it. There's the toolkit for writing an LTE or op-ed, and then the toolkit for amplifying. So both of those links are in the chat.
So I'm going to, I think this is a good use of time. I'm going to show as I put, let's see. So I'm going to screen share right now, and I'm going to show you guys as I put, in case this is helpful. Let's see. So I'm going to like copy and paste this first sample social media post, and I'm going to go to my Facebook account, and I'm just going to put it in like one of the groups that I'm a part of. So hopefully this works. And if you want to do the same, that would be awesome. Share in a group. I joined all these physician Facebook groups just recently so that I could do this. Totally taking advantage.
Hey, I rejoined CMA so I could do the same. So
Okay, it's
Bravo.
the way it works, right?
and now I'm on their delegation and chair of the vice chair of the delegation now.
That's right. So I guess these ats don't matter in Facebook, right? Okay. But this will be cool because then everybody in the group will see the post. If I do it right. Theoretically. I think I just broke Facebook, but that's the idea.
So actually, you know, being not a millennial and in the older group, what exactly did you post to Facebook? I mean, I just need really specific,
Yeah.
like, give me what I should put.
Yes.
And
So
then I can do it, but
I appreciate that question.
voices.
So I'm gonna try it again. So what I did is I went to the toolkit and I copied the first post that was pressed about the letter, and then
The amplifying toolkit. There's two toolkits.
Yes. So this post, the public news service, is an interview of Amanda about the letter. So what I'm doing is I'm putting it in a group that I'm a part of on Facebook, and then the group will see the post.
Right. No, I got that part. It's just
Okay.
what you're actually posting. So I have the amplification toolkit.
Mhm.
So what is it that you took out of there?
Good question. So let me go back to that. I took the first post that was like part of the bullet. Stop.
So the
sharing.
higher temperature
Yeah,
exacerbate pollution and drive spikes in heart attacks.
that's right. Yeah.
Okay. And just, you just literally just copied the whole thing.
Mm-hmm.
I did, and then because these things only work for they only work for Twitter, I subtracted out the signs. So I just put the rest of, do you guys see?
Yeah, but you kept that hashtag act on climate.
I did. I subtracted. Sorry. All the hashtags and the I took out for Facebook because those only work on Twitter, right, everybody?
Yeah,
And Instagram.
I don't think
if
you need
it's-
to worry, like Bonnie. I mean, so prefacing, like, I don't think any or certainly I can claim no social media expertise, but these posts were written almost entirely by media and communications people to try to help, help us amplify this. That being said, it wouldn't be bad to keep, it's not like something is going to get messed up if you included all of that in what you posted.
Well,
So
I like the hashtag Act on Climate. I would leave that.
Yeah,
So
you can
taking
leave
out
that.
all that other stuff, the at
Yeah.
Fox News, I'm taking that stuff out.
Yeah, absolutely. And I think with Twitter, Facebook, and I don't use LinkedIn, but I don't know if LinkedIn has word count issues, but Twitter is where you get into the most trouble with character count, but it's very obvious if you are exceeding your character count. But with Facebook, you don't have a limitation. So I wouldn't worry about including something that doesn't necessarily mean something on Facebook and having it not be meaningful in any way.
I think that maybe the take-home message is to just copy and paste each of the bulleted blurbs in the amplification toolkit to as many social media groups that you can, in order to get more eyes seeing the press that we've already gotten about the letter. Does that sound right? Is that clear? And then, yeah, if you could think of a local paper to submit an LTE template, and again, you just copy and paste it and kind of, edit it a little bit. If you could do it today or tomorrow, because, as people are voting, we want them to think like, oh yeah, I saw that LTE and these doctors and nurses are worried about climate. Maybe I'll shift, maybe I'll prioritize that when I vote. That's obviously what we're shooting for.
And even more than persuading someone to vote differently is persuading someone to get out and vote who might otherwise sit it out.
Definitely. Are there any questions?
Just one more question about the Facebook. So you posted to physician groups, and that's fine. I'm a member of some, but what about just regular folks? So should I just go through and see which would be appropriate for kind of a wider audience of people?
Yes.
Yeah, I was thinking, I've been if you could send it to, the WISPA, sorry, we want to get out of the echo chamber. So for anybody, we would like everybody to see this, to see these posts. So beyond physicians, if you want to send it to schools or churches or, soccer teams, yes, everybody is who we'd like to see these.
And just to address, Heather, thank you for that question. Just to clarify, the letter is still open for signing. I just put the link to the Google form in the chat again. And while that isn't our primary focus right now on trying to get more signers, it is absolutely still open for signing. And I think we will, again, I think this is also related to the idea of opening this up for more allied health professional signers as well. But I think at some point we will come back. It may even be something we do on a monthly basis and just look at who we've gotten in that last month and update our numbers. Now that we've sort of done that for the largest chunk, I think that could actually be pretty doable on a monthly basis. So please, please continue to spread to ask for signers. Yeah.
But the other thing is, after November 3rd,
right.
it becomes a little bit, outdated.
It's right.
We have to address that. And I would strongly encourage, I usually say if somebody says somebody should do something, then they have to do it themselves. But I'm not going to say that this time, but it might be a good idea for folks to come up with something that we can do ongoing. And I think you're saying that, Amanda.
Yeah. And I would love to hear people's thoughts on that. Not necessarily, it doesn't have to be right now, but you're totally right, Bonnie. The text of the letter is pretty specific. It is very specific to this election. And we're going to run into issues where I don't think we could automatically just roll over. We can't like apply those signatures to anything we want. So the question is, do we re-recruit signers for something new? Like that, if that is exciting to anyone to think about, please reach out to us, because I think there is a potential life for this well beyond the next week. And there's like, we've worked with a lot of organizations on this, but I think this has really been CHN's project. Like we have the, I don't know what the right word is, potential to control what happens with this going forward. So if that's exciting to anyone, please let us know.
And the other thing is just to take a different approach and maybe have it not necessarily be a letter, but be just a public service announcement, just kind of inundate, the airwaves with, and also the Facebook ads, because I'm doing that for my campaign and it took a long time to get it set up. But once it's set up, you just put a certain chunk of change in the bank and you just run off of that. And I think that's a great way. We've reached thousands of people in a couple of days. So the potential to reach a lot of people is there. So that's something also to think about.
Yeah, well, I'm sure it will evolve and it'll become clear, how to keep building on it. But I think, are there any other questions about like how to use the social media toolkit or the letters to the editor toolkit? No? Okay.
Maybe something like this already exists, but in terms of like a longer living version of the letter, maybe if there was like desirable, aesthetically pleasing artwork or wall poster that physicians could have in their office that basically says like, please vote for your health. And then any interested physician could say like, yes, I'll post this in my practice office. And then that would just be this thing on the wall for probably years or a decade, because nobody ever takes stuff down.
I think your poster is beautiful. The poster that.
Yeah, that's a cool idea.
Yeah, like exam room flyer type of thing.
Yeah, a long-term prescription like, dear patients, I, name of doctor, implore you or like encourage you to vote for your health in every upcoming election, and very non-specific about like who and what, but just like, please, I hope all of my patients will vote. Voting is essential for community health or something.
That's an awesome idea. Vote Health 2020, the Manisha group. They have posters and all kinds of things for your office. You can even customize it for your location and your office. But it's not what you're describing. It's not like artfully nice that you would keep up necessarily. It has those QR codes to register to vote and all that. But that's a great idea.
Perfect. It probably doesn't have to be artful, but just something like,
well, that would be nice.
And it sounds like
though.
that is that, but something that like just very clearly communicates to all patients, like their doctor is pleading with them to be part of an active citizen.
Yeah. Yeah.
I also like this idea because I like the idea of having this long term in offices, because I think it makes the barrier to, and like I can only speak for my own clinic, like it was a really big lift, or like a big mental lift, to go from not having any messaging about voting to then like me being like, we need to put these posters everywhere, we need to wear these badges. And I think if we normalized it more in the next few years, that we get to the next or the midterm elections, the next presidential election, it will be less kind of jarring to people to welcome these things into our offices.
Yeah, great point. And it's not just every 4 years, like you're just mentioning. It's going to come around again.
If anybody is interested in aesthetically pleasing graphics about health impacts of climate change, Linda just shared a really great resource that I've used. So that's not about voting in particular, but it's another patient education kind of resource to prompt discussion. So I think maybe we could shift to kind of on the wrap-up side. And so I was going to, so I'm going to share my screen again. I wanted to give just a few minutes to brainstorm a little bit more about what people are doing in these last 6 days. So Linda sent an email, I think a week or two ago, about kind of, staying focused on actions we can be taking. So if anybody wants to share, and like Amanda said earlier, we'll compile kind of a list of resources. So we have 6 days to go, like what are people doing? We already heard about the Environmental Voter Project, which is facilitating phone banking. Flip the West is one. Are there any others people would?
I just put in the chat a little while ago, link to the Doctors for Biden phone banking sign up. Today is actually the last one, but if you sign up, it's at 3:30 this afternoon. If you sign up for that, or if you just go to the Doctors for Biden or the Victory 2020 website, there's tons of opportunities to get out the vote phone banking. There's a Healthy Energy phone bank. There's a Doctors for Biden phone bank. There's a Families and Children phone bank. There's so many opportunities. There's state-specific ones if you don't like phoning, which I don't. There's also opportunities to do texting. And they're targeting the states that they think need it the most. So both in terms of where the polls are, but also in terms of where they're at relative to their election cycle, like, which states have just started doing early voting, where do people really need to get reminded that they've got to take their ballots to a ballot box instead of mailing them in now, and that kind of stuff. So, and if people have questions about it, you can email me.
Yeah.
Just to put in a plug for texting over phone, like I also have found I really like to the texting more. And for anyone who hasn't done it, I think one of the main questions is like, do you have to use your phone and use your personal phone number? And you don't at all. It's all done through a website.
Now, which one are you using, Amanda? Is that the?
I've also, like Linda, done the Doctors for Biden, which is through 2020 Victory, whatever the official Biden campaign is called. And you just basically get on their Slack and go through a quick training, and then they post out a link every day that has the assignments, and you just sign up for one. It's really pretty easy. Like it's just the most annoying thing is just clicking buttons, truthfully.
Okay.
Not too bad. Any other things that people are doing that feels useful in the last stretch?
I have something about not this last stretch, but maybe looking into the future. I think I'm really, as I said to one of my psychiatric colleagues, choosing hypomania over crouching right now, because I feel like there's two choices for how to feel. But assuming my hypomania pays off and I don't have to crash, I think we are going to get more into the particulars of what climate health looks like and how we're going to be pushing whoever wins or doesn't win to do what needs to be done. And so I just wanted to put out there my interest in like getting into the particulars, getting into the pros and cons, looking for the greenwashing, like, like getting into the weeds around not just saying we need this, but like starting to push for how we need this.
Like you mean specific bills and what we should bring the
bills, efforts, environmental racism. Like, I think as we talk about clean tech and new tech, there's going to be a lot of confusing signaling around what's the safest choice. And I think that we will be important voices in that.
For sure.
Yeah,
absolutely.
I would like to ditto that. I've been doing some texting for Sierra Club, but I also work with a lot of other climate groups. And one of the things that is going to be locally important in Sacramento is dealing with our local utility that has several power plants that are in areas of low income and disadvantaged communities.
Yeah, definitely. I think this kind of brings me.
Illness.
Oh, sorry.
Yeah, well.
Did I cut you off? I didn't.
So I just wanted to point out that, you know, our local issue is maybe our utility, getting them to do some closures. And that is how some of this all leads into fighting for the climate.
Yeah.
Well, yeah, exactly. Or the ways that all these oil fields, like during COVID, were just like left empty to leak. Stuff like that, you know?
Yeah,
definitely. It's less sexy, but it's like horrifying, you know?
Yeah, I think so. The Climate Health Now's strategy priorities are decarbonizing California, which kind of both of those fall under it. And that means, you know, things like getting fracking banned and electrifying our transportation and kind of moving forward things with CalGEM, which we'll talk more about next month. So decarbonizing California, decreasing the demand for fossil fuels in California. The second of our key strategy priorities is divestment. And this is actually a good segue. We have launched a US health insurer divestment campaign in a coalition with over 60 other organizations across the country. And it's health professional led, but also in coalition with environmental advocates like Moms Out Front and 350, Sierra Club. So we're asking the top 10 health insurers in the US to divest their investments from fossil fuels. And that's going to be kind of our focus for, you know, our divestment focus for the next year, probably at least. And then the third piece is kind of advocacy, activism training for health professionals so that we feel very comfortable and kind of, you know, can easily articulate to everybody how climate justice activism is part of being a health professional, how that's part of the professional obligation, and really giving our members the tools and the confidence to do that in a way that feels seamless with the rest of the care we give people. So those are our three priorities. And so I think those fall in, and there will be local fights for sure. You know, like AB 345 was an example from last year, and we will build those in the year ahead. I think, so one other thing we wanted to just mention is we held a really great webinar with our San Francisco Bay Area allies last week. And it was about kind of in the intersectional environmentalism, and I think it's really captured well in a quote by Hop Hopkins, who says, "We can't have climate change without sacrifice zones. We can't have sacrifice zones without disposable people, and we can't have disposable people without racism." And so the webinar we co-sponsored with PSR last week was really about how racism is related to climate change and how white supremacy is related to climate change, because these are not things that everybody can confidently articulate. And part of our work is to connect all of those and to, you know, realize that we're all on the same team to put people over profits of the few. So that was really fun, and we're going to build on that. And I wanted to name one of the speakers on the panel was from a group called Arm in Arm, which they describe themselves as the sunrise for people over 35 years old. So that's me. And they're offering a training in disruptive humanitarianism, which is basically nonviolent disobedient action. So I'm going to participate in the training that's coming up on November 12th and 13th. It's obviously virtual, and it's from 2:30 to 5:30 both days. So that is a cool resource that we'll share out in kind of the summary from today. And then just kind of wrapping up with saving the dates, and the month or two ahead was what I had in mind. So our next Climate Health Now community meeting like this is weirdly going to be on a Thursday. we're coming into kind of the holidays and lots of other stuff. So it won't be too far away. It'll be Thursday, November 12th, 12:30 to 1:30. And we're really going to focus then on the U.S. health insurer divestment campaign and asking for people to help to boost that and bring more visibility to it. Our first company that we're going to be targeting is Cigna, who has $2.2 billion invested in fossil fuels. So that will be a very action-oriented webinar meeting. And then really excited about Wednesday, November 18th, from 12 to 1, we're hosting a media training with Sarah Spengeman from Energy Solutions. Is that right, Amanda?
Energy Innovation. But and previously with Healthcare Without Harm.
Mm-hmm. And that's going to be all about electrification, right?
No, sorry.
Oh,
there's two.
Training. Sorry.
Yeah, that's a media training. Yeah.
So do you want to speak about that a little bit?
Sure. Yeah. So Sarah Spengeman is now with Energy Innovation. She does all of their media, and previously was with Healthcare Without Harm. I don't remember what her official title was with Healthcare Without Harm, but she also did a lot with media relations. And so she is offering to put on a media training for us. And I think we're also going to open it up to health professionals, at least throughout the state, like let all of our allied organizations know about it as well. We should have more information about that in the next few days. But really trying to help us understand how we can be effective communicators with the media, what to expect when we are being interviewed, what to expect specifically with different types of platforms. Especially, I mean, I can imagine most of us, if not all of us, would feel this is not something that we've ever really been trained on before, especially in light of what we learn in medical and nursing school, et cetera. So it should be really good.
That's what we learned.
Right. Yeah. And she's just a really lovely, wonderful resource.
Yeah. And the way I see this is, we're doing tons of organizing of our coalition, and this media training is part of kind of building up our toolbox for when we mobilize and when we need somebody, say, from Southern California to talk about the Dear Patient letter tomorrow, and these are always urgent. So kind of really getting comfortable in speaking as a health professional to the media. That's what it's all about. So really encourage everybody to do that. I'm gonna participate to build up my skills. And then Wednesday, December 9th, we'll have a webinar on electrification and why that's a health issue. So really helping to kind of, build up our confidence in talking about why we should ban gas hookups in new construction in California and everywhere, and to have kind of the evidence to be able to talk about that in a clear and confident way.
And that'll be in partnership with Rocky Mountain Institute and one other, Christine, I don't know if you're still on the other group as well. I don't know where Lauren is from.
Lauren is, oh yeah, that's great.
There's another, it's Rocky Mountain Institute and another group.
It's another group.
Yeah.
And she's really good. Yeah.
Yeah.
I can't remember.
Sorry. Yeah, it'll come to me too.
More details when we send out the invite.
Yes.
And then Friday, December 11th at 8:30 will be our December community meeting like this. So lots of exciting things to look forward to.
Oh, sorry. It's Lauren is from Sierra Club, California.
From Sierra Club. Okay.
Awesome. Yeah. Yeah.
So I wanted to say one thing as we're talking about all of these things that we're going to do in the next 6 days and then thereafter. And one is that I'm super proud of everything everybody has accomplished, and also of being part of CHN. I'm really proud of all of you and feel, I think that's why we come together for these meetings, is that it really gives us the feeling that we're one sample, but there's many of us, thank goodness, who think like we do and who are actually doing work to make progress. So as we think about all these things that we want to do after the election and until the election, for me, I sometimes feel like I'm going crazy with the world so upside down that if we know the winner on November 3rd and it is Joe Biden and Kamala Harris, then I think it would be healthy for everyone to take some time to just be still and like reflective. And I'm no psychiatrist or psychologist, but I just think everybody needs to pause and just be so grateful that there will be change. And while it'll be rocky and bumpy, like Madeline was saying, there'll be all sorts of talk about what to do and not to do and how, and there'll be plenty of work, but we also just need to take a breath.
Yes, yes. And as a psychiatrist and more important, a meditator, let me know if you guys want to get together and just breathe. I know that's a weird thing to say about Zoom. It's not fancy, but like, I'm here. I'm ready.
I think it's a great idea. I did a meditation course for about, I don't know, weeks when COVID first started. So,
well, here's an open offer that I'm going to just like offer to myself, and you can join me. A November 4th meta meditation. Do you guys know loving kindness practice?
Yeah.
Just a grounding meditation. Would anybody be interested in doing that together?
Yes.
Yep.
Sure. November 4th.
Out in the streets. Yes.
Oh, I mean, I was like going to do it in my kitchen, but like I taught a class at Occupy San Francisco called Composting Anger that was geared on basically trying to contain Black Bloc and all this violent anarchistic movement stuff. But we did a lot of grounding with this Buddhist loving kindness practice in every meeting. So I can't do it at 8:30 on the 4th, but I could do it at 9:15. I don't want to hijack the CHN airwaves here, but it's just an offer.
You're not.
Community effort,
Yeah.
Madeline. You're part of the leadership team.
Yep. We can. Madeline, why don't you just email us when you want to do it and we'll share it out.
Yeah.
Okay.
Yeah.
Okay, great.
And maybe, I don't know. I was going to say maybe we could record it, but maybe that would take away from it. I'm just thinking, like, I know personally, like I'll be at work then.
Some people
I prepared it to teach into Alameda County to the PCPs who are on the front line with COVID. We actually like structured something. So I have a structured talk, and if you want to record it, that's okay.
Yeah, if it feels right, or record some of it. Yeah. But let us know. Like you can just email me when works, and we can get the Zoom set up.
Okay.
I think everyone will need that.
Yeah.
And just to review, November 11th at 8:30, is that correct?
November 11th. Ashley, did you stop? Here, let me look back on the slides. Sorry, for the next community meeting.
Yeah.
November 12th. There is no calendar invite for that yet, but we will get one because we just made it up. But we will be sending that out.
There was something about November 11th though. Did I miss something?
So, okay. So November 11th, there is not something.
Veterans Day.
That's Veterans Day. So we decided to move it to Thursday, just in case people are occupied with Veterans Day or don't have childcare, et cetera.
But it says, will you send links to December 11th webinar? That there must have been something else.
So I was just kind of putting in the chat, I'll send all the links.
I'm sorry.
Let's close
it's okay.
it out.
Yeah.
We will send the schedule and the calendar times to everybody.
Yeah, and the dates in the slide are correct.
Yeah.
So you can disregard what I may have said in the chat.
Yeah, so we'll send that out by email. Thank you for joining. It's great to see you all, at least, and to have everybody spend your time with us. And then one more little piece, I cannot recommend more highly this book, All We Can Save. Yeah. So if you need some grounding, there's like little pieces. It's an anthology of women in climate leadership, and it's so inspiring. So if you need some company with like thought leaders for saving the world, definitely recommend it. And we will follow up soon in email, and hope you all have a great day. Last 6 days before the blue wave.
Right,
you.
and
Bye,
does
everybody.
everyone
Thank
have a
you.
voting plan?
We can do it.
Do it.
Oh, yeah.
We can do it. Thank you for all your leadership. You
Thank you,
all
too,
y'all,
all of you.
Climate Health Now, folks.
Thanks, everyone.
We better
Thank
do
you.
it.
Be well.
Bye, everyone.
Bye. Thank
Have
you
a good
all.
one.
Oh, boy.